shared playground equipment with 50 other kids. So not the swing set for K through 12 at daycare. You don't want your kids eating congregate meals with people outside of their small play group. You want your kids to stay with their play group. And if your kids are over 2 years old, you want to ask your daycare and help get the other moms to help you mask those kids, because we are now seeing outbreaks in daycare, and we are seeing people on ventilators that are young in our hospitals. So we don't want this for our kids, and we don't want kids bringing it home to mama and grandmama either. So these kind of common sense things, by the way, they can all be found if you wanted to Google CDC, Center for Disease Control, and daycare. There's some real common sense things for daycares to do until the state puts together guidance for daycare, which I'm going to be pushing hard on them to follow the CDC. And as luck would have it, one of my dear friends runs Health and Human Services for Governor Abbott, so hopefully we'll have some success there. But don't wait for that. Go ahead and do that now. If you live outside of Dallas County, where we don't have masking rules yet, frequent places where everybody's wearing a mask. If the place is not one, and unfortunately this could mean restaurants, if the place is not one where everybody's going to be wearing a mask all the time, at a time when we are at a record surge and it's going to get a lot worse before it gets better, just don't go to places where everybody's not masked. And with that, I'll take your questions.
Great, thank you, Judge. Our first question is from Terry Meza. Is there any protocol in place for what a business should do if an employee tests positive? It seems to vary widely from closing the business to keeping it a secret.
Well, there's HIPAA rules, and I don't know if we have like Dr. Wong. I don't think we do get doctors on these calls. If Dr. Wong or one of the doctors is on the call, please jump in with exactly what you can do. And if I don't hear them, I'll take a stab at it. Okay. So, if you can tell people you've had a COVID positive at your work, they may be able to figure it out, right? If it's a small workplace and I'm not there and everybody else is, you can probably figure out I'm the person that had COVID. But the other workers have a right to know, and they will know, because if David and I work, real close to one another, and we're around each other for 15 minutes a day or more, without being 6 feet apart, he'll eventually get a call from a tracer. But we're having a really hard time with tracing. Right? Tracing is, so I get sick, I give you my 15 or 20 people that I've been in close contact with, and you contact them. Because there are so many more people getting sick because of this big second wave, it's not, what happens is I get tested on Monday. I don't get my test back till Thursday. And because the tracers are way behind, they don't call until maybe late the next week. So what the businesses can do is, once you find out that one employee got sick, and you can kind of do your own trace there. You can say, we've had a sick employee in food processing on the second shift, who works, in this area. I'm not sure, I wish there were a doctor on here, whether you can say, and it was Clay Jenkins, I don't know if you can or not, but you could then encourage people who have any symptoms at all, or whose contact with Clay was 5 days ago or longer, to go get a free test. you can isolate. It's a good idea to isolate those contacts. So, for instance, in a business like many of ours, where it is a professional service corporation, if one accountant has COVID, it's a real good idea to let her personal contacts telecommute for a few days and to see if they develop symptoms. Because what can happen is you could end up shutting your whole business down or creating a scenario where next door is saying that your business is a COVID hotbed. And so it's best to be, proactive and, pretty aggressive when you have an outbreak and send folks home in that area.
Yeah, thank you, Judge. The one question that is coming up is this: are we still in the first wave? People are talking about a second wave. Are we out of the first wave yet?
Well, Dr. Fauci and I call it a first or a second wave. I think I don't know. I know President Trump says it's the first wave. The important thing to know is, so before the Open Texas deal, which we were all for reopening the economy, but when we reopened it, we reopened businesses like movie theaters in the first wave, which is not what CDC recommends. And we didn't open up in tranches or sections where we could watch them closely. And we didn't have adequate testing around that first opening. But most importantly, all those requirements like temperature check and 6-foot distance, workstations and alternating shifts and all those sort of things that we had going for us in Dallas County and all the urban areas before May 1, the governor outlawed all those things. And so we were seeing a pretty good flattening and a little bit of a decline from that work up until, late May. And then we saw this thing shoot up like a rocket. And that can be tied back to the lack of requirements that we were done away with in May. Every decision you make bad decision you make takes some time to hurt you. So for instance, if we all screw up really big on 4th of July, because that would be all of us screwing up, we could feel that within 2 weeks. If it's just a mistake in the way that we handle, a few things, then it takes sometimes a month to 6 weeks to see that screw up. So, you can call it a first wave or a second wave, but the thing to know is you've gone from like 170 new cases in mid-May a day to 450 new cases today. You've doubled your hospital capacity in the region, or a hospital, not capacity, but your hospitalized COVIDs. And so it's time to take it, not that you ever didn't, but it's time for people to take this extremely seriously. People that heard about all the openings and thought, well, if it's okay to go to a bar and a bowling alley, it's probably okay to have a fireworks shoot off at my ranch, in Ellis County, and invite 30 of my friends. Well, unfortunately, it's not. With what we're seeing, you're in a more dangerous situation now than you've been in before, ever, with COVID.
Right. And do you think that's a function of more testing or more cases? What kind of tell us how that correlates in Dallas County?
So testing could explain some why there's more positives each day. Testing has nothing to do with why the numbers in the hospitals are doubling and now going up every single day, right? Hospitalizations aren't about who drives through the test site or goes to the CVS. And the reason, if you remember about a month and a half ago, the CDC and the local hospital said, look, there's going to be more testing. Don't focus so much on how many people are newly found COVID today. Focus on hospitalizations, because that's the number that will tell you how wide the community spread is. And so when you look at that number, you're seeing pretty wide community spread.
Great, and you've been telling us that all along, so we really appreciate that, Judge, to watch the hospitalization rates. We have a question from Ariel Graham from the Rambler newspaper. How does Dallas County plan to enforce the rule of wearing masks inside all public businesses?
So people can lodge, I don't have the number, unfortunately, but somebody can get it for you. People can lodge complaints with Dallas County Code Compliance. And it's going to be a very soft enforcement, right? Because businesses lobbied for this. We had the Dallas Black Chamber, the Dallas Regional Chamber, the Dallas Citizens Council, the AT&T, Central Markets. I'm probably leaving people out here. And of course, the hospitals and the doctor associations all lobbying for this because businesses wanted it. So, businesses won't be fined if one of these code people walks into their business and somebody doesn't have a mask on. You might have a person that's severe asthmatic and can't wear it, or, it's kind of like loss prevention. The fact that you have a policy to keep people from stealing doesn't mean occasionally you don't have shoplifting. I'm not saying people that that don't wear masks are thieves, but it's kind of the same concept of a plan. An implemented plan does not mean perfection. What we're seeing though, just from everybody that's going out, is it's working very well. Now, and every store that anybody who works for me has been into, it's been like 100% mask. So that's a good thing. On the office buildings, it's any commercial enterprise. So you might have a call center that the customers don't come into your business, but the call center sells widgets, over the phone. And so the way that would work is if you're 6 feet apart, like if David's in his office with the door shut, there's no mask requirement. But for some reason, if we can't be 6 feet apart and we're engaged in commercial enterprise, so not a food bank, not a church, but a commercial enterprise, then we're going to be masked. That's going to be businesses should want to do it because we now know it's the best way to keep your employees from getting sick. And think of the PR nightmare of, people posting on the internet, my employer is making me do this and won't let me do that and blah, blah, blah. Well, now who wants to buy my stuff? So we got to figure out, there's a safety component and just kind of the common sense, consumer confidence component that we've got to let people know that our employee safety and our customer safety is a penultimate concern to us right now.
Yeah, absolutely. Also in the news has been voting by mail. Are there any plans for Dallas County to vote by mail?
So there's a case in this. There will be voting by mail for sure in Dallas County. So there's a case in the Supreme Court right now to determine whether people under 65 can vote by mail. Any person can request a mail-in ballot. Any person of any age can request that. And there's no, enforcement on the part of the county to determine why you requested it. However, the current law is that if you're disabled, so if I'm currently sick, let's say I have COVID, I'm currently, that's that would impede, regardless of what the Supreme Court does, that person, no question, can vote by mail. Or if I have cancer, or I broke my ankle and I'm on crutches and it'd be hard for me to go, all of those people can vote by mail regardless of being 65. The question becomes, for all of us who have no immunity to COVID, and with the governor and everyone telling you it's very important to large crowds, and with the courts themselves being afraid to hold hearings in person and holding them by phone to even determine what they want to do about mail voting, is that a disability? Is our lack of immunity a disability that in and of itself would justify being able to vote by mail? That is something that the U.S. Supreme Court is looking at. And so that is an open question that we don't know the answer to. But any other reason, you know the answer to. And as a practical matter, you may have, I don't know this, but you may have a lot more people request mail-in ballots. And again, there's not a mechanism. If 1,000 people request mail-in ballots, the law doesn't have a mechanism for us to go find out why they requested them. So regardless of what the law is, you may have people do that. But right now, the law, until the Supreme Court decides, is the old law that the Attorney General and the governor are pushing so hard, is that it wouldn't be permitted if I'm under 65 and otherwise healthy and have no disability or impairment from voting, for me to use my lack of immunity to COVID to not vote in person. I'd have to choose to vote in person if I wanted to follow the law, unless it's changed. And of course, I'm with the people, and I think it's a growing number of people. Look, if the Supreme Court's afraid to even have oral arguments with people in the room because they don't want to be around, groups, and if the governor is on his press conference yesterday and the day before saying avoid groups, it's just kind of common sense. We ought to give people the choice of voting by mail or voting in person.
Excellent. And also, with discussions of other counties in the area, do you think they'll adopt the same rules that you're adopting here in Dallas County?
Well, it depends on the rule. So I think because of all of the rhetoric and the confusion, brought about with the Open Texas stuff, it will be longer, for instance, on masking before other people adopt it. Because at first, when we first did this, like for instance, Safer at Home, we didn't have leaders in the just to be blunt, we didn't have Republican Party leaders saying anything negative about masking or stay-at-home orders or anything. Most of the surrounding counties it's elected offices, they're Republicans. So when you've got your leaders that are higher up than you giving mixed messages, it's going to be slower to adopt these things. I think it will ultimately happen. I think we have a lot of good county judges in the surrounding counties. And as this thing just keeps getting worse, and it's going to get, it's growing, right? When you're doubling 1,000, you're growing a lot faster than when you're doubling 500. So, eventually, I don't know how many days that is, you'll start seeing people adopting masking. It's not really a controversial thing in other places because there are already 31 states out of the 50 that require businesses to have masks on their employees and patrons. And there's already 15 states that, Republican and Democratic states, that require masks on everyone when they leave the home. So I think you're going to see more of that. Unfortunately, it's going to be a hodgepodge probably of, what's allowed. It may be that we don't have a big fireworks display in Dallas County, but you go over to Collin County and you can get 10,000 people together. I mean, I don't know if that'll happen or not, but that's a possibility.
We're almost out of time, so just to recap, we currently have masks are required in Dallas County today. That's going into effect today. 100 people, will that be a new rule of 100 people gatherings, as you mentioned from the governor?
I've asked public health to look at it. There needs to be rules around that. It doesn't necessarily mean that I just don't know, because they need to tell me. But it doesn't necessarily mean that it could mean that we're not going to have groups of over 100. It could mean that when we have groups of over 100, they have to be 6 feet apart and wear masks. I'll just have to wait and see what the doctors and hospitals tell me.
And for daycare centers, you have the CDC guidance you told us about. Do you think that'll be a new rule as well?
That's what I'm asking, Phil Wilson, who's heading it up for the governor, to look at. And I'll be talking to him later today. But don't wait, Mom and Dad. Go ahead and just, call and get it. If a group of concerned parents call and say, hey, look, my kid's in the first grade, there's 6 kids in there. I talked to the other moms, and here's what we want. We want those kids to eat, in their own little group. We want most of their activities to be outside where breath dissipates. We want a mask, whenever possible. We want their hands washed this often. You look at those CDC guidelines, you tell them that's what they want. They're in the business, they're consumer-driven business like my businesses and your businesses. You tell them it's what you want, you'll get it. And I wouldn't wait around too long for other people to do it for us.
Great. And we're out of time. And everybody, if you have more questions, please email the judge or his staff. They're great at answering questions on the Dallas County website. So please go there. Judge Jenkins, can you leave us with the few last thoughts?
Sure. We will get through this. I think that we're very hopeful that if we're all doing the masking, that can help some. As we've said over and over again, don't focus on what's legal, focus on what's safe. It's more important now than ever that we look at what those CDC and local health guidelines are, which you can get, by the way, at dallascountycovid.org, and we follow those. But, we're in for a rough summer and a rough fall, and we've blown that lead that we had, whatever it was 6 weeks ago. But it's up to all of us now to get this thing back under control. And I'm really proud of the way our business community has responded throughout this. And now we're just going to have to suck it up and be even more effective because of what's happened. But we can do it, and we will do it together.
Great. Well, thank you, Judge, and we look forward to talking to you again. And thank you for your leadership here in Dallas County.
Thank you.
Okay. Thank you all for joining us. And once again, if you have questions, please email the judge and his staff. They are great to get answers, and go to the Dallas County COVID website. They have a ton of information for us. So everybody stay safe and wear your masks. Thank you all.